A woman's first sexual intercourse is often misunderstood due to unrealistic portrayals in movies and pornographic media. In reality, experiences vary widely depending on emotional readiness, physical comfort, and personal circumstances. The legal age of consent differs across countries and cultures, and it is essential that any sexual activity occurs within legal and ethical boundaries. In some societies, premarital sex is strongly discouraged or considered immoral due to cultural or religious beliefs, while in others it is accepted as a normal part of life. These differences influence how individuals perceive and approach their first sexual experience. Social expectations, family values, and peer influence can significantly shape attitudes toward intimacy, often leaving young individuals confused or underprepared. The hymen is a thin, elastic membrane that partially covers the vaginal opening, and its structure varies greatly among individuals. It can stretch or tear due to non-sexual activities, such as exercise, tampon use, or accidental injury. Despite this, many cultures incorrectly associate an intact hymen with virginity and purity. This misconception has led to harmful practices such as virginity testing, which have no scientific basis and can negatively affect women's physical and emotional well-being. Medically, the presence or absence of a hymen is not a reliable indicator of sexual history. It is important to address these myths with accurate information to prevent stigma and unnecessary pressure on women.
There are several misconceptions about first-time intercourse, including the belief that significant pain or bleeding is always normal. While mild discomfort or slight bleeding may occur in some cases, many women experience little to no pain or bleeding during their first time. Another common myth is that using protection reduces pleasure. However, condoms are essential for preventing sexually transmitted infections, STIs, and unintended pregnancies. It is medically possible to become pregnant or contract an STI even during the first sexual encounter. Therefore, proper use of protection is a critical aspect of safe sexual practice and should not be neglected due to misinformation. Open communication between partners is essential before engaging in sexual activity. Discussing fears, expectations, and boundaries helps build trust and ensures mutual consent. Expressing the need for protection, such as stating, "I would like to use a condom," is a responsible and necessary step. A supportive partner will respect these decisions and prioritize shared safety. Emotional readiness plays a key role, as engaging in sexual activity without a foundation of trust, honesty, and respect may lead to emotional distress or regret. Setting clear boundaries and making informed decisions are vital for maintaining both physical and emotional well-being.
Physiologically, the experience can be more comfortable when the body is relaxed and adequately prepared. Foreplay plays a significant role by increasing blood flow to the genital area, enhancing natural lubrication, and reducing discomfort. Emotional intimacy can trigger the release of endorphins and oxytocin, hormones that promote relaxation and reduce pain perception. The use of a water-based lubricant can further minimize friction and discomfort. Contrary to common fears, the first experience does not need to be painful if approached gently and with proper preparation. Comfort, patience, and mutual understanding significantly improve the experience. Bleeding after first-time intercourse may occur due to stretching or tearing of the hymenal tissue, but it is not universal. Some women may not bleed at all, especially if the hymen is already stretched or naturally minimal. If bleeding occurs, it is usually light and temporary. However, heavy or prolonged bleeding accompanied by symptoms such as severe pain, fever, or abnormal discharge requires medical attention. Awareness of these variations is important to avoid unnecessary anxiety and to distinguish between normal responses and potential health concerns.
It is also common for the first sexual experience to be less than ideal. Psychological factors such as anxiety, nervousness, or lack of experience can affect performance and comfort. In women, conditions like dyspareunia, pain during intercourse, or vaginismus, involuntary muscle contraction, may occur, making penetration difficult. In men, issues such as premature ejaculation or temporary erectile difficulties are also possible. These responses are generally normal and often improve with time, communication, and experience. Seeking professional help from a healthcare provider or therapist may be beneficial if such issues persist. After the experience, open discussion between partners about feelings and comfort levels can help improve future interactions. Real-life sexual experiences differ significantly from idealized portrayals in media, and there is no standard definition of a perfect first time. Each individual's experience is unique and should be approached without unrealistic expectations. Sexual intimacy is a learning process that evolves over time, and comfort, satisfaction, and confidence typically increase with experience and with the right partner. Prioritizing health, consent, and mutual respect ensures a safer and more positive experience overall.